Our community and states responding to COVID-19.
Each person who gets coronavirus appears to infect about 2 to 2.5 other individuals.
I don't think we should stop until 100,000 tests.
The most important thing right now is preventing the spread of COVID-19.
We've never experienced a crisis of this nature.
Mitt Romney has been an unbelievable leader.
This is serious.
We went to a home church model worldwide.
And the only way we're going to get through this and have our companies succeed on the other side of it is if we really come together.
I want to commend Silicon Slopes and all those who were involved in it.
You know, I think the Silicon Slopes serves funds an opportunity for us to reach out locally.
Things will get back to normal and the world is not collapsing.
Mark, I can't thank you enough. You're a superhero.
Slope Serves has turned into just an amazing effort across the entire community.
To get involved, visit slopeserves.com to donate, volunteer, provide medical supplies, and keep informed on everything happening. Welcome to today's Silicon Slopes Town Hall. Today we'll be speaking with Senator Mitt Romney, Director of Utah Office of Childcare Tracy Gruber, Traeger Grill CEO Jeremy Andrus, and Nomi Health CEO Mark Newman. At the end of today's town hall, we'll also be answering some questions that have been submitted to our organization. As a reminder, Silicon Slopes hosts these live town halls every Monday, Wednesday, and Friday at 4 p.m. To submit questions, email townhall@siliconslopes.com. This afternoon, the state updated the current COVID-19 conditions for Utah. As of today, March 30th, 2020, there are 806 known cases, 4 known deaths, and a total of 16,003 total people tested. Each person currently who tests positive infects between 2 to 2.5 people. I want to give a quick update on everything happening within the Silicon Slopes organization. As many of you know, we've organized a new initiative called Slope Serves in response to COVID-19. Within Slope Serves, we've launched a COVID-19 community response fund to fund the following: more testing kits so any Utahn who wants to get tested can get tested. We're spinning up testing centers in partnership with state and local health officials. We're getting personal protective equipment in the hands of medical personnel, getting food to those who need it most right now, and responding to the economic crisis Utah small businesses and restaurants are experiencing. Our goal is to raise $5 million for this fund, and all funds raised will go directly to the efforts I just described. As of today, we've managed to raise more than $1 million for this fund. So we're off to a good start. To learn more, to donate, to get involved, and even to join our COVID-19 Slack channel and newsletter, visit slopeserves.com. As part of our fundraising effort in partnership with Cotopaxi, we've created a One Utah t-shirt, which can be purchased now. Go to slopeserves.com for more details on that front. Cotopaxi CEO David Smith just texted me right before we came on and said we've already sold thousands of these things. So go to slopeserves.com and you'll get the link to be able to buy that shirt. In addition to Slope Serves, Silicon Slopes has created 2 committees within our organization to lead our response to COVID-19. The Health Response Committee is chaired by Nomi Health CEO Mark Newman and is tasked with, among other things, getting more testing and PPE to medical personnel. The Economic Response Committee is chaired by Traeger Grill CEO Jeremy Andrus and is tasked with empowering Utah's startup, tech, and small business community with the tools and resources they need to get through the economic crisis caused by COVID-19. As I mentioned at the top, we have both Mark and Jeremy speaking to us today. And I just want to thank them for their leadership, chairing both of these committees during this time. And with that, I'd like to go to Senator Mitt Romney for an update on what's happening on the federal level. Senator Romney. We have you mute. You're muted, Senator.
Is that me or is that you has to fix that? No, you have to fix that.
There you go. We can see
you. There you go. All right.
We can hear
You're
you.
The ones. Yeah, there you go. Okay, I'm on. Just a couple things to bring up to date. First, thank you for the work you're doing on slopeserves.com. Very impressive that you raised $1 million already, and that Copaxi is helping with the t-shirts. I understand also you've been helping on sourcing some personal protective equipment members of the community have, and that's obviously very important to the entire nation, but particularly to our state. Just an update on a couple of things that you may be or may not be aware of that relate to federal programs. I've spoken at some length about what's available for firms with 500 employees and less. Let me tell you what's happening on the firms that are larger, if you will, the middle market companies and large companies. About $4 trillion of capacity has been put into the Fed's hands. And they're applying that in a couple of ways. One is by direct purchases of corporate bonds, either in the primary market or the secondary market. So they're trying to provide additional capital and liquidity by doing so. And the second effort is called Main Street Lending, which is they're trying to get funding to local banks so that local banks are able to make loans to businesses of all sizes. These will be at market rates. The regs on this and the guidance on this have not been set yet by the Fed. And we keep on trying to get information about just exactly how these things are going to work out. And they have not been able to tell us yet. But I would stay in touch with your local bank, any bank that you do business with, and see what they're learning. If you need additional funding that's going to be backed by the Fed, and therefore will not present risk to the bank and will be at a relatively moderate interest rate, then I'd keep in touch with those banks. A couple of the things that may relate to businesses of all sizes. One is we changed the tax law with regards to net operating losses. So losses from the years of 2018, 19, and 20 will be able to be carried back for a full 5 years. And instead of those losses being limited as they have been in the past, there will be no limit on the amount of income they're able to be offset against. So if you got NOLs for 18, 19, or 20, recognize you can go back and recast your prior year taxes and hopefully get some cash as a result of doing so. The other is that interest expense, which has normally been limited to 30% of EBITDA, that percentage is being increased to 50% of EBITDA. So you'll have a little more capacity this year to reduce your taxes. Those are things that relate to some of the larger companies. Then some smaller companies. There are two types of financial vehicles that are available to smaller companies. One has been around a long time, and it is called the Economic Injury Disaster Loan. Economic Injury Disaster Loan, or EIDL. And these EIDL funds, you're able to get a loan of up to $2 million. They've typically been associated with a natural disaster, hurricane, tornado that's taken down a building. You get one of these loans to rebuild. These are loans that have to be paid back, but they're available to institutions that are in distress. Utah has been declared as a disaster area, and as a result, these EIDL loans will be available to Utah businesses. They are the interest rate is 3.75% for for-profit companies, 2.75% for not-for-profits. There's also a measure that was just introduced this year with the legislation that just came out a week or so ago, and that is an emergency EIDL provision, which says if you need $10,000 in a hurry, the SBA will get it to you in within 3 days, and this $10,000 amount, or up to $10,000, does not have to be repaid. So it's basically free money from the government, and it sounds to me like you ought to take advantage of that. You can get this, by the way, by applying directly to the Small Business Administration on their website. The other program that's been spoken about at great length, I won't take a long time here, is the program, and I'll make sure I get the right name, the Personal Paycheck Program, the Personal Paycheck Program, or PPP. And this is the program where an entity can apply, again, for businesses under 500 employees. They can look at their average monthly payroll in the past, before the COVID-19 crisis, and they can get 2.5 times, a loan equal to 2.5 times their average monthly payroll. This funding, if it's then used to maintain your payroll, to pay rent, to pay utilities, and only those things, then the loan is going to be forgiven. So again, it feels a bit like free money, which is you borrow this money, you maintain your full payroll, your full personnel count, your FTEs, and then it'll be forgiven. I would note that if you've already laid people off, in order to qualify for this, you're going to have to hire them again and bring them on the payroll. And then this loan will allow you to pay them, keeps them from having to go into unemployment insurance. Instead, they stay working for you. But again, you're getting a loan to allow you to do that. I note that with regards to all these programs, whether it's the mid and large scale company, whether it's the EIDL program or the PPP program, that I believe time is of the essence. There's not going to be enough money to fund these programs for every company in America that's feeling distress. And so getting to your bank, getting to the SBA as soon as possible, and as soon as these programs are fully fleshed out, makes a lot of sense. Getting the details on this can be obtained by going to the website that my office maintains, which is romney.senate.gov. Go to that website, click onto the appropriate link, and you'll be able to get the updated information as we get it from the feds. One more thing I'd mention, you already know this, but part of the legislation increased the pay for unemployment insurance a lot. So unemployment insurance in Utah has been around $350 per week. This takes it up to $950 a week. We add $600 to each check, regardless of what the check is. It goes up by $600. So a number of you may decide that you're going to take advantage of that, and your furloughed employees will take advantage of that effort or that facility. Let's see, just one other thing that I'll mention. Actually, two more things. One, just some business advice. I was in a similar situation to a few of you some time ago. I was running a company of about 1,000 people. We were about 2 weeks away from bankruptcy. And there were some things we did at that point that I think I'll pass along to you for your consideration. One was we decided that we were going to take a careful look at who we were going to pay and who we were not going to pay and who we were going to stretch receivables on or payables on. And, we had to look at each of the institutions we owed money to and figure out who could absorb our delaying their payment and who could not, who would come after us and who would not. But it was a very careful analysis where we decided, okay, here's what we're going to have to do to make sure that we can keep our doors open. Second thing, we decided who we were going to provide funding for. In other words, who we were going to let our receivables stretch. There are times, you're going to have plenty of customers that need help. And if you allow them to pay you a little later, you're going to create a friend for life. So that was another part of what we did. And both were important. Third, and perhaps most important, we focused. We decided, let's look at what is absolutely critical for the survival of our business in this tough time. And let's then organize the effort to focus on each one of those elements. So we created a task force for each one. We put someone in charge of each one of the elements. So someone was in charge of the bank, someone else was in charge of employee relations, someone else was in charge of our real estate relations, and then someone else is responsible for all of our customers. So we had task forces for each one of the various elements that was critical to our survival, and people responsible for working on those, reporting in every day to myself and the management team. And finally, I'll just mention this, which seems a little strange, but with regards to this business advice, it's important, I think, to rethink the design of your product given the post-COVID-19 world. Now, some businesses won't change much, but some will. There are going to be new products developed in a world where people are concerned about the kind of thing that just is happening to us. And that's going to present opportunities for a number of us. Finally, I'll just note this on the last topic. I keep saying finally, I know that's getting you irritated, but I'll say it, I think, for the last time. And that is, I'm encouraged by the steps that are being taken in Utah and the steps that the governor and lieutenant governor are taking. I would note that I hope that we're learning lessons from Asia, particularly from South Korea, from Taiwan, from China. They have not just reduced the number of people that get infected by a person who is infected. It began, by the way, to get the numbers right. It began in China. They were seeing, what was the rate here? They were seeing 3.88 people infected by any one person that had the disease. They got that down to 1.25 by virtue of social distancing, pretty extreme social distancing. But as you know, if you're above 1, the disease is still growing. And the only way to stop the disease, as they have in Asia, is by getting it below 1. And the way they did that is pretty straightforward. And that is they tested a lot of people. Anybody that showed any kind of signs of a fever or any kind of sickness, they tested. If they found them to have the disease, they then engaged in contact tracing. So they traced all their contacts, family, business, and so forth. They tested all of those people. Anybody that was found to be carrying the sickness was then put in isolation. They separated and isolated anybody who was sick. They put them in hotel rooms. They put them in student dorms. They took over facilities and they put people in separate places. If you did that, they were able to get the communication rate down below 1.0. And that's how they stopped the disease. And by the way, it'll pop back up again, but they know how to deal with it. Massive testing, contact tracing, and then isolation of the people who are infected. So if we want to get Utah to that point, those are the kind of steps we're going to have to take. With that, Clint, I'm going to turn back to you. Say thanks to all of you at Silicon Slopes for the work you're doing, and let's keep in touch. If there's any questions that you have for me, pass them along.
Senator, I have 2 follow-up questions for you, just real quick. One being, around these disaster loans, these economic industry disaster loans. I just want to double click on this and make sure everybody hear what you said. All of Utah has been declared a disaster zone, correct?
That's correct.
And then the second one is just, I love the advice you gave around, different companies and orgs that you've turned around and advice you had in particular with the one that was going to go bankrupt in 2 weeks. What leadership advice would you have for those watching this call right now as you're making those tough decisions? You know what I mean? Like, so many people and so many companies and so many CEOs right now are having to make really, really, really difficult decisions. On a leadership front, what advice would you have for them?
I guess the strength that I got was from having a really strong team with me. And some of the people that have been in the enterprise, actually the company I'm talking about had its own management team. They invited me to come in. I swept them aside. I mean, they stayed in the company, but I put them aside and brought in a team of people who I thought were more effective at doing the job that needed to be done. So when you decide what's got to be done and you focused on the key priorities, you got to have the right people in place to manage those priorities. But I guess I get strength by the people that are very close to me that are managing the various task forces I put in charge, and then extensively communicating with the entire organization. I mean, when things are, when the wheels are coming off, people get really frightened. And many times the fear is greater than the actual risk and the actual danger. And so extensively communicating with people is perhaps the single most important thing a leader can do at a time like this. And that's not just your senior people. Communicating with them strengthens you, but it's also the people that work throughout the organization. I just saw a survey that was done of Utah businesses that asked, I think it was 14,000 people across Utah, is your employer communicating with you more than you think is appropriate? And the answer came back from, I understand, every single person, no, right? So they want to hear more. And knowing what's going on, knowing what you're doing takes away some of the fear and gives people more confidence in the future, which I think is important right now.
That was a Qualtrics survey, I believe. Senator, actually, as we've been talking here, there's a couple more questions from those who are watching this, if that's okay.
Yeah.
One wants to know if you could speak to the affiliation rule and how it will affect venture-backed companies.
Yeah, this is a real bummer. I got to tell you, and you've heard about this, which is that the legislation with regards to these funding programs, these loan programs, specifically said that if a company is majority owned by venture firms or by private equity firms, that these entities will not be able to get these loans. And it's kind of a dirty trick. I've tried to understand why that was put in the legislation. My guess it was just to be punitive, that some people don't like private equity and venture capital and think that those people are too rich anyway. But the reason that they give instead is that these firms, venture capital and private equity firms, typically have a lot of money, and that if money needs to be extended to one of their portfolio companies, they should do it as opposed to the government doing it. What they don't realize is that private equity firms and venture capital firms are going to do what's in the best interest of their investors. And that may or may not be to extend money to a business in trouble. So I mean, I think it's an inappropriate action on their part, but what basically says is if you're majority owned by venture capital or private equity, all of the firms in the portfolio of that firm, of that private equity firm or venture firm, are going to be considered as the employees of the same entity, and therefore are larger than the 500, of course, and will not allow you to take advantage of these, particularly the Small Business Administration loan program.
And that's still in effect. Like that hasn't been changed. That's what's going to happen.
That's what's happening right now. I doubt it'll be changed. The question I've got is whether I would anticipate that such a firm would be able to take advantage of the large business, if you will, Main Street lending facility. I don't know that, but I presume they may not be able to take advantage of the 500 person and less facility with the forgiven loans, but I would anticipate would be able to take advantage of the Main Street lending. But I don't know that. That's just my hope and expectation.
Senator, what if a company is minority owned by a venture fund?
I don't think. Well, excuse me. I think I was, when you said minority owned, I thought you were talking about ethnic minority, but you mean percentage ownership.
Yeah, percentage ownership, where the venture firm only owns like 30%, say.
I believe in that circumstance, the firm will be able to take advantage of the SBA program. But again, I'm not 100% certain on that. They have not written their regs. They anticipate coming out with their regulations the end of this week. This Friday is what the Treasury Secretary said today. So look closely. We'll see what they write, how they write that up. But I would hope that they would include capacity for firms that only have a partial ownership stake by private equity or venture.
And Senator, the great Jeanette Bennett, who runs all of Utah Valley and basically all of Utah, is asking, when figuring average payroll, can we include contractors we pay with 1099s?
I don't know the answer to that.
Yeah.
What I've heard, again, that's going to be taking a look at the regs. And of course, one question is, well, when you figure average payroll, over what period? Is it going to be, the month of March from last year, or is it a full year last year? How do you show what your payroll was? I've heard people can just use their FICA reports to show what their payroll was. But again, that's going to depend on the regs that come out from SBA hopefully this week.
Senator, I don't know if this is a question that you can answer, or even if you can give an opinion on this, but there's been a lot of talk at the state level, and obviously everything that you're working on and the position you hold is at the federal level, but there's been a lot of talk at the state level here in Utah about tapping into Utah's rainy day fund. And you've been a governor, of Massachusetts. Does that make sense now? There's almost $1 billion in the state rainy day fund. Again, I know this is probably a little bit of a politically charged question. I don't know if you want to answer that, but what are your thoughts on that?
Yeah, my guess is the state will use its rainy day fund for state-related expenses, public health expenses. $1 billion is not going to go very far if it's trying to lift the entire economy of the state. That's just not going to be possible. And funding to individuals in need, that would be gone in a heartbeat with $1 billion. And so I would expect, were I in a setting where I had $1 billion rainy day fund and a state of 3.5 million people and a huge economy, I'd be looking myself to say, okay, we've got to make sure and use these dollars wisely to make sure that we have the public health capacity we need, so that when we see the crescendo of illnesses and hospitalizations, we're able to cover those costs.
Senator, how do you feel like the federal government's doing at this point in responding to this?
Some good things, some bad things. Good things, the decision by the president to delay or to stop flights from Wuhan, China, that was a good thing. I'm kind of agnostic on how well they've organized the effort at this stage. I mentioned how I typically think about organizing a response to a crisis, which is dividing it into different tasks, having task forces for each one, clear responsibilities. I don't see that in the public domain at this stage. Now, they're broadcasting to the general public, not to business people, but I'd like to know who's in charge of personal protection equipment, who's in charge of ventilators, Who's in charge of getting tents for makeshift hospitals? Who's in charge for our testing facility? Who's in charge for contact tracing and the technology necessary for that? Who's in charge of getting hotel rooms and so forth, and coordinating with states to do so? That seems, I just don't know how well that's being organized at the federal level. And so I'm looking increasingly to the states and saying, if the federal government's not doing it, the states are going to have to. There are some things, I hear governors talking about, which is, hey, we all want more ventilators. Who's coordinating that effort? And Washington says, we all go out and get your own. It's like, well, you can't all get your own because the ventilator companies are overwhelmed with orders. So someone has to decide who's going to get how many, and coordinate between the different companies. And that may be happening. I just don't see it. I guess I'd finally note that I think it's helpful to give people a very realistic sense of what may happen so they can prepare. And I think we've given people mixed signals along the way, and hope that changes. But the biggest thing for me is I think this effort I think we have to stop looking like Italy, because social distancing is going on in Italy, and look how well that's working. I mean, that's helpful, but it's not enough. We really have to get to a testing regime followed back by contact tracing and by isolation. And I don't see us doing that at a national level. Hopefully we can do that in Utah.
And last question for you, Senator, before you go here. You had a number of calls, I believe, in partnership with Silicon Slopes today with chambers around the state. What did you learn from the chambers, and how are small businesses in the state of Utah doing, given the calls you just had today?
I don't think it's fair for me to characterize what, from those calls, because I did most of the talking. I did get a number of questions. The questions that I got were, how can I get one of these loans? Particularly one of these loans that's going to turn into a grant and be forgiven. And the answer to that is go to the SBA, get on their website, or come to our website, and follow the rules that are laid out, and be one of the first ones in line, because that money is going to get gone before the need evaporates. One of the other questions I got was, are we going to have a, if you will, phase 4? Will there be another bill with another effort to help businesses? And my expectation is yes, because I think the crisis is going to go on longer than just a few weeks. But getting something through Congress is very, very difficult. I think it's interesting. It's easier to get something through Congress when it's an emergency and it has to be done in a hurry, as this last phase was. Now that we have time to plan, this thing is going to get larded up by everybody's pet project, and it's going to get harder to pass if we're not careful. So I don't know what's coming along, but I get more information by talking to my regional directors across the state, and you probably know Adam Gardner, who heads my office in Salt Lake, and Kelsey Berg, who's a Utah connector for us in Washington. What we're hearing is a lot of businesses are feeling like they're in pretty good shape. A lot are really struggling. Our restaurants are really struggling, and a lot of people have been let go, have been laid off, and they don't even know where to get unemployment insurance. They've never thought about being unemployed. They've had a job all their life, and now there are no jobs for anybody. Once you get laid off, there's nothing new. So we're trying to get help to those people as quickly as we can.
Thank you so much for joining us, Senator. Really appreciate it. Now
Thanks,
I want to turn to the Director of Utah Office of Childcare, Tracy Gruber. Tracy, this has been a major issue. We've had a lot of inbound from Silicon Slopes companies and folks within our community about childcare. Yeah, and you actually had a major announcement today. Can you talk about that for us?
Yeah, thanks so much, Clinton. Thanks so much for the support of Silicon Slopes on this effort. You all have been with us since we started, which was only 2 weeks ago, but it feels like maybe a year and a half ago. And it started with a charge or a request from the Lieutenant Governor to, given that schools are now closed, there's obviously a lot of children at home, and there's concern actually nationwide for making sure that our first responders and our healthcare workers, with their kids still being at home, have childcare so that they can show up to work. So obviously the challenge is now with schools closed, how are these parents who we need for Utah's health and safety, how how are they going to go to work? Where are they going to get childcare so that they can show up for work every day when we need them to be caring for us? So with that charge, we pulled together a task force made up of the hospitals, Intermountain and the University of Utah, and cities and counties, and education, business, Silicon Slopes, of course, childcare providers, to come together to try to figure out how we're going to tackle this issue. And what we came up with over the past couple of weeks was to establish a temporary emergency childcare system. It's been a little bit of a challenge because we don't know yet what the needs are. I think a lot of parents, for the first couple of weeks that schools were closed, thought that this is something they can rely on their networks for, and we were encouraging that, in fact, initially. But we realized pretty quickly that there needed to be some sort of network of childcare providers that were going to support these families. So today we announced One Utah Childcare, along with the governor and the lieutenant governor, which is going to offer free childcare for these, what we're calling essential employees from these two sectors, from healthcare, law enforcement, public safety, first responders, those two sectors. We know that there's lots of essential employees who are beyond those sectors, but we are focused on the need of those two sectors. We're bringing sites online every day. There will be more every week that these parents can apply for assistance through our office. We will assign them a site and they will be able to go get free childcare Monday through Friday from 7 a.m. until 6 p.m., basically covering the hours that schools would be open. So we're really excited about it. We've gotten a lot of support. As I was sitting here, got a text to learn that Slope Serves is donating baby wipes. So thank you so much for your help and assistance in that. These programs are going to need some materials and supplies, and you all have been very helpful in that regard. So that's what we announced. We're looking forward to it. It's a little bit like, as the Lieutenant Governor said today, building the plane as you're flying it, and we're doing it, and we'll get it right and make sure that these families don't have to worry about this right now while they're protecting our health and safety.
Well, Tracy, please let us know if there's anything you need. Obviously, and we're happy to help on the baby wipes, but if there's anything you need there, please let us know. And I'd love if you could tell those, watching this who may, work in the medical industry and, may, be part of this group that we're trying to figure this out for, how to contact, where do they go for the One Utah Child Care Initiative?
Great question. So they can go to our website, jobs.utah.gov/COVID-19. There is a section on that website for One Utah Childcare. It includes all the intake information that a family would fill out if they believe that they fit within this essential employee definition, and we will follow up with them. There's also information for potential sites. If there's schools or childcare programs that have closed and they're willing to exclusively serve this population, they can sign up there. And there's also frequently asked questions that we'd really like people to look at first before they contact our office to see if we've been able to answer their questions.
Well, thank you so much for everything you're doing, Tracy. Really appreciate it. Again, anything that Silicon Slopes and the Slope Serves Initiative can do, we're all in.
Thank you so much. Appreciate your support and help.
Now I want to go to my good friend, Traeger Grill CEO, Jeremy Andrus, who, as I mentioned at the top of this, is chairing Silicon Slopes' Economic Response Committee. Jeremy, can you give us an update?
Yeah, absolutely. Happy to, Clint. First of all, I think one of the pieces that we are most focused on right now is really understanding pain points of entrepreneurs. I think Senator Romney hit on what really matters to these entrepreneurs. How do you get a loan? How do you get working capital in your business? How do you do it in a way that is painless, and not only for DC attorneys to figure out, and how do you do it fast? And so with that in mind, I think one of the most important things that one of the pieces that we're doing now is getting ready to communicate or to ask members of the community, what are your pain points? What industry, what size, what are your needs? How long do you have left? How can we help? And I think our ability to build helpful ideas really does start with a deep understanding of small business owners. So we have prepared a survey. It's actually on slopeserves.com currently, and over the next 24 hours, we will start to push that out through email, through social, and we want to start by asking exactly what's on the mind of these business owners, so that we can be helpful.
So we need everyone to take it. You can take it right now at slopeserves.com. I think this is critically important that all those watching this who are small business owners or, own a startup, CEO, anything, take the survey, go to slopeserves.com to take that. Jeremy, what else is the committee working on currently?
I mean, look, it's, having talked to a couple of small business owners over the last 24 hours, there is no question that time is of the essence, and really understanding what is available is critical. So as we hear back from entrepreneurs, and currently we're in the process of just preparing some helpful resources. We call this the easy button. We're creating some resources that can very quickly help a small business owner understand what's available, how do I access it, how do we cut out some of the the language that just isn't helpful to your Main Street small business owner. And so we're in the process of preparing some of that content. We want to get it up quickly. In fact, we've already on slopeserves.com, we've already launched an emergency financial checklist. These are some of the things that, again, Senator Romney referred to. If you haven't been through this before, being able to go through a checklist of things around how do I manage working capital, who do I pay, who do I stretch, who do I collect from, what are the things that I need to quickly get in order, given how this scarce commodity of time, how do we help these small business owners quickly figure out, how do I go through a checklist and know what to do? Then we're in the process of preparing, I think, some resources, again, that will be housed here around how they navigate some of the financial services. How do we communicate out to them, how they meander this organization? The CARES Act. I mean, there is so much in there, and we just want to create some summary information where they can double click and really quickly go through a process. The survey, this is a fluid situation. If you talk to a small business owner and you ask them, how has your understanding of this situation and of your business and your financial condition, how has that evolved over the 2.5 weeks since this thing started? You will find out at moments in time, it's changing. We're all consuming so much information. And so we're going to be doing this survey regularly. We want to understand along the way, how are we doing? How is the environment changing? How do we make sure that, as opposed to this static moment in time, we have built resources, how we're responding, updating, and being dynamic in terms of the solutions that we can share back with those agencies who control the purse strings.
Jeremy, I'd love to ask you the same question I asked Mitt around leadership during these times and how you're thinking about that. And also, you're doing something really interesting around how you're maintaining the culture of Traeger. You have like this morning show you've created. I'd love for you to talk about how you are connecting and staying and maintaining the culture of Traeger, when everybody's working from home.
Yeah, I mean, look, I think first of all, this is when leaders earn their money. This is when this is when leaders create their legacy. When everything is going right, anyone can lead that organization. Stepping back and being able to make the right decisions quickly, with the lens first and foremost being on your people. That's how we think about it. And so, we broadcast out to the Traeger team from China to, Copenhagen, around the country. Senator Romney nailed it. We communicate a lot, and we're communicating a voice of confidence. When you don't communicate, people assume the worst. As this thing is fluid, sharing information that can give not only confidence in our financial health, but the fact that we are being thoughtful around a plan and sharing strategy. This communication, it creates trust, creates unity. But look, a lot of this communication is not just business. Friday evening, we had the company on a virtual happy hour. And you know what? We didn't talk about business at all. We told stories. We laughed. We toasted. Some people were holding babies as they did it. And all of these things, there is an extra effort. We're really amplifying anything we can do that make us feel connected. And you know what? I got to tell you, we're learning. We're actually learning that as we amplify these efforts, they are extremely effective, and we're actually getting better. These are things that when we get back together, we can continue to do day in, day out. So look, leadership is, people need to hear a voice of confidence in a very, very chaotic media-driven world right now.
Jeremy, thanks so much, my friend. I appreciate your leadership, and for you chairing the Economic Response Committee for Silicon Slopes means a lot. Everybody go take this survey. Go to slopeserves.com. It's on there now. We need people to take it. As Jeremy mentioned, we'll start shooting it out to everybody via email and all the other ways we do it. But all those watching right now, go to slopeserves.com. And with that, I want to go to the chair of the Health Response Committee, Mark Newman, for an update there. Mark, take it away.
Thank you. Okay, everyone. So I'll bring back PowerPoint to keep us feeling like life works. So here's the update. We are moving and rolling as fast as we can. We need some help in various ways. We have a shot at solving this. So Clint's already mentioned, you're seeing an increase in test results, an increase in activity here. Utah's doing about 1,500 per day right now. And you're seeing this trend up around the overall infection rate at about 106. Last week, we were trending right with New York in the same part of the curve. Today, we're trending right behind New York in this part of the curve. So that's being behind them is a good thing, right? This is the one time we don't want to be curve breakers, as many of us try to do here in university and school. I just want to remind everyone on who's on the Slopes Health Response Committee. I'm just going to go ahead and call this the Get Stuff Done crew. We are absolutely rocking as fast as we can, and each person is in charge of something different. So Dave Elkington, Josh, and I are on assessment and testing. Matt Lyon, Chris Klomp have been deeply involved on industry response. John Mayfield, Rob McMillan, John Mayfield and Rob McMillan on tracing, and Jake Turley making sure that employers broadly and generally are bringing a terrific understanding around the ramifications around what's going on when it comes to health benefits, employee benefits. How do we end up doing this? How do we end up rent up testing? You name it. Each person is focused on executing, and each one of us is focused on executing on the exact same goals that Senator Romney mentioned. Mass testing anytime, mass treatment available to people, tracing and activity, and creating an opportunity for people to get the care they need and the access they need. And our goal, of course, is to get people back to work and school. Okay, Required reading for everyone, because I think this is important. Former Mayor Ted Wilson wrote an absolutely beautiful article today in the Deseret News talking about when the ox is in the mire and when Utahns came together to save the day. This was just a fantastic piece from his time leading Salt Lake City when the floods happened in 1983, which was before many of us were born, around, living here, you name it. And I just think it's the right thing for right now. We're seeing this on slope serves, where people are coming from all out of the woodwork in all sorts of ways. We've had supply chains contributed. We've had people donate. We've had crazy things happen that we'll be able to talk through even more here over the next couple of days. On deseretnews.com, Ox in the Mire, give it a read. What we are doing this week, you're going to see a statewide digital assessment launch in the next 24 hours. This will be one of the first in the nation that's meant to cover everybody and to understand it all, to understand kind of how we're seeing health and to be able to self-assess as you're going through it. Testing is going. We are first rolling this out right now with patients and healthcare workers. We actually heard that the earthquake actually took some test capacity offline on some traditional lab providers, and we're here to pick up the slack and getting people in senior care centers, group homes, hospitals, you name it, tested. Mountain Star and HCA are doing a terrific job as partners here. We, as a state, need to get to between 7 and at least 7,000 tests a day, if not more, to really help understand where we're at epidemiologically, how we're seeing new infections, how we're seeing the new infection rate, how we're tracking this, and how we're addressing it. It seems like the slopes community that we've put together might end up doing even more, almost more than half of that, which is going to be amazing. To give everyone else some context as well, California is currently doing something like 1,000 tests a day. And we're trying to get to 7,000 here in Utah. We're leading the way for the nation. And next, the first kind of giant deliveries of PPE are coming into the state. One of the untold stories here that we need to make sure gets told over and over and over again is how companies that you've been hearing about have just opened up their supply chains and creativity and ideas to solve the problems. We've seen companies like ATL and Alpha Pro and you name it just come to the table with massive opportunities and massive supply chains to mobilize protective equipment for our frontline workers here, and that's incredible. So we have a lot going on. We're standing up 5+ locations. Dave Elkington and Josh Walker on my team have, I don't think they ever thought they'd be in test center logistics in terms of their life and business. This is drive-through tents, 4 people at a time, manned with trained lab tech workers, collecting samples, going through it all, and working that across 5 high-volume locations: Airport, Orem, Provo, Salt Lake, Summit County, you name it. Not to mention integrated back with the digital assessment on the front end, signing up and scheduling for screening, requesting your time and location, showing up to get it done, having it tracked and scanned into the system, lab test run, results given back. I don't think any of us thought that we would be doing this. I have a big background in assessment in the hiring side, and it has a lot of parallels here. Next on Wednesday, we're going to be demoing, frankly, for everyone, the entire workflow here. It's not like nothing that exists in the country, and I just want to give a shout out there to Dave Elkington, Josh Walker, the Qualtrics team, the Safe Lane Health team. There's teams behind it on integration of scanners and you name it. It's incredible. So we'll be demoing on Wednesday everything, and that'll be a lot of fun. What you can do now, each and every person on this call. So we'll be launching on utahtest.com the statewide health assessment. Share it, take it, promote it. We want to have a massive sample of people doing this. Second, through Slope Serves, help the helpers. Amazon, what we're finding is the state is doing a terrific job aggregating supplies on the high end, yet we're seeing community health clinics that are out of soap. You've heard it from the child care group. They have an enormous number of needs around mobilizing this. We're asking them all to either send in their requests to Slope Serves or also create Amazon wish lists. We may not be able to buy it all on Amazon because supplies are out there, but it gives us an indication of what they need and what they want. No one needs $100,000. What they need is $100,000 of stuff, right? And we can get to work helping them find it to do it. And then let's get ready to get tested and let's get back to life. So keep calm and carry on. We are going to have an enormous number of updates this week and next. I think Utah will be the shining star in the nation for how we mobilized assessment, testing, and tracking.
There really is an amazing effort underway. And this week is going to be critical. So everyone make sure, look out for utah.test.com to be launched. Mark, thanks for all of your efforts. Someone who does have a question, if you could answer real quick, on when do you anticipate a test might be available to determine if you've had and resolved COVID-19, not just if you currently have it?
So there's the antigen tests that exist out there. We've seen them from local companies and national companies. I don't know if the exact kind of science totally exists on that yet to know, right? We've seen everything from people testing negative, then positive, to people testing positive, and they're taking another form of diagnostic test until they respond with negative. We'll get more research on that. That's a great question, and we should pull that into the strategy for the state. We don't know the answer yet.
So if anybody has any questions, we're going to turn this last few minutes here into kind of an ask me anything type format or Q&A format here. A lot of folks have submitted questions to us, and to do that before a town hall, you just go to town hall. You just email townhall@siliconslopes.com. I'm going to burn through as many of these as I can, and we'll stop here right at 5. So here's some questions we've had. In Utah, do we know how many hospital beds, ICU beds, ventilators, and masks we have? Do we know daily status on usage of beds, ventilators, and masks? Are we on track to close the gap on potential peak need and current supply before peak hits? Are we on track to slow the spread in line with best practice states via aggressive testing of first responders and others who are high risk of spreading the virus? So I'm going to answer, this is what my team has gathered. If this isn't accurate, anybody raise their hand or let Drew know, and he'll unmute you as we go through here. But the answer to those is the state of Utah is currently collaborating with healthcare partners across the state to get these numbers. However, in a recent report, the Harvard Global Health Institute found that even in its best case scenario, Utah likely would not have enough ICU beds for all the patients who need them. If only 1 in 5 Utahns were to become infected over a slow course of 18 months, the least severe outbreak that the report calculates, all 700 or so of the ICU beds that researchers identified in Utah would likely be full. On the other hand, if it takes just 6 months for 20% of Utahns to be infected, patients would overwhelm not only Utah's ICU beds, but also its regular hospitable beds, the report stated. And if coronavirus in Utah is more infectious than that, 40% is the moderate expected rate, according to the study. All hospitable beds, both I keep saying hospitable, it's hospitable beds, both in and out of ICUs would likely be full, even if the spread is slowed to 18 months, the model predicts. All right, that's the answer to that. And by the way, it's hospital beds. Will Salt Lake City-based businesses be required to receive official essential business classification from the Utah Governor's Office if any stay-at-home executive order is issued? Not necessarily. Right now, all stay-at-home orders are following federal guidelines of what an essential business is. Check Twitter now. We're putting that up. According to the feds, any employee simply needs a note from their employer with the employee's name, the essential industry identification, and the type of work they are doing. Another question we got. What considerations are being taken on domestic violence, suicide, mental health, and economic balance with social distancing? This week, we're hosting Silicon Slopes Live with advocates from the Utah Domestic Violence Coalition, the YWCA, the University of Utah mental health experts, and mental health professionals from Intermountain healthcare. Tune in so that we can do some deep dives there. Another question we got is a lot of larger Silicon Slopes companies are looking into purchasing tests for their employees. Is that the best use of those tests? I actually don't know of that being the case. I think, in fact, I think the opposite is true there. I think Silicon Slopes companies are rallying around to get a test for every Utahn who needs it. Do we have enough data to confidently predict how long this pandemic should last? No. The answer to that's no, currently. The virus is too new. Do tests show if people have had the virus already and recovered? Mark kind of just answered that. There are some blood tests being done in laboratories. The UK is doing that. You can look at that. Just to be clear, do you have to have symptoms in order to be tested? Currently, that's the case, but Silicon Slopes and the work that Mark and the Health Response Committee is doing, I think will change that very soon. How do we address the people who are not taking this seriously? Is there a commitment by Slopes companies to do everything in their power to protect their employees and the public? Silicon Slopes, at the very beginning of this, encouraged all companies to implement work from home protocols immediately. We continue to do that every day. You need to take it seriously. Anyone who's not taking it seriously, is not being responsible. Another question we got is, why isn't everyone getting the same information? I don't know, the best place resource for information. I think the Utah Coronavirus Task Force, their website is doing a great job of compiling that. You can also go to slopeserves.com and find out all the information there. So anybody else who has questions, there's a whole bunch of other questions, but I want to make sure that we're ending this thing on time. Email townhall@siliconslopes.com. If we can answer it, given our network of experts, we'll bring experts on to answer it. I want to thank everyone for coming onto this thing. You can tune into the next one, which is Wednesday at 4 p.m. Please check out slopeserves.com, buy a t-shirt. What Davis Smith and Cotopaxi did for this community is unbelievable. The fact that we've already sold thousands of those things is unbelievable. Slope Serves is making a difference. Thanks to all of you. Appreciate you for tuning in, and we'll see you on Wednesday at 4.